So Texas is once again making headlines for all the wrong reasons, with the Washington Post reporting on a rise of abandoned babies in the state, and a complete sense of apathy from legislators in response. And the Post are not the only ones to report on this. Back in August, a local Houston news affiliate reported a 500% spike of abandoned babies in the city. In 2022, there was just one case of abandonment. Last year, there was 4, and in this year, there have been at least 6. Across the state, according to the Washington Post and the Texas Department of Family and Protective Services, at least 18 babies have been abandoned this year. A decade ago, that number was just 7. And in March 2022, which is now almost 2 years ago, CBS News' Texas I-Team were also sounding the alarm, reporting that across the state, the rate of newborn abandonment had almost doubled, from just 12 in 2018 to 22 in 2021. Showing that newborn abandonment has been elevated in Texas for years, which isn't surprising for a state with some of the most restrictive laws surrounding terminations in the country. And yet, despite Governor Greg Abbott promising to protect the life of every child with a heartbeat, the state has not taken any action in response. In fact, despite the state spending $165 million funding programs and education around termination alternatives, such as funding deeply problematic and deceptive crisis centers, as well as the state reporting a $32.7 billion with a B budget surplus, lawmakers have not committed any funding to raise awareness and help prevent babies from being abandoned. Across the entire state, there are just 5 safe haven boxes, and not a single one of them is located in any of the major population centers, such as Austin, Dallas, Fort Worth, Houston, or San Antonio. The state also has safe haven laws that were passed in 1999 in response to a rise in newborn abandonments a quarter of a century ago, allowing parents to surrender their newborn to any hospital, fire, or EMS station without question if the newborn is unharmed. However, advocates argue that there's been almost no funding by the state to help educate or raise awareness about these laws, relying on third-party donations to just even put up signs. But this isn't the only area where Texas is severely underfunding women's health. The Post points to the Commonwealth Fund, which provides rankings on healthcare systems in developed countries. And it ranks Texas as near last in the country when it comes to healthcare quality and prevention for women, and dead last for health coverage, access, and affordability for women. Which is bad enough by itself, but worse still when put into the perspective that, according to the Texas Comptroller, if Texas were its own country, it would be the 8th largest economy in the world. So it's not a lack of money, it's just a lack of concern or interest that gives the state the rather ignoble distinction of having the highest percentage of uninsured women in the country. 1 in 5 Texas women have no health insurance, severely limiting their ability to access and afford healthcare. And it isn't just Texas's lack of funding for women's health that is exacerbating the problem. The Washington Post details the story of one mother, just 18 years old, who abandoned her child. An undocumented migrant from Guatemala, she followed her older brother to Houston as a teenager, staying with relatives and finding work at a taco truck. She was assaulted by a relative and became pregnant as a result. Frightened and scared, she was worried that she would be abandoned by both her family and her boyfriend if they learned of the pregnancy, so she kept it a secret. Security cameras at a parking lot recorded her leaving the taco truck to kneel, give birth next to the vehicle before abandoning her child. She had no idea of the options available to her. She'd never had any sex education and was afraid to go to a clinic because she'd heard that Texas officials were deporting undocumented migrants. In August, Governor Greg Abbott passed Executive Order GA-46, which as of November 1st required all hospitals that receive public funding to inquire about the immigration status of every patient they treat. The justification for this was a desire by the state for public hospitals to more accurately track the cost of healthcare spent on undocumented migrants. But healthcare workers fear that this will not only put patients at risk of deportation, but also actively discourage patients from seeking necessary healthcare, and leave vulnerable patients, like this 18-year-old mother, without support and any possibility for healthcare workers to provide crucial interventions and education. The rise in child abandonment in Texas is the entirely predictable and completely avoidable consequence of the state's restrictive policies around immigration and termination, as well as its lack of funding and prioritization of healthcare and health education for women. And until they are made a priority and funded by the state's budget, we'll unfortunately see many more of these heartbreaking stories.